Welcome back to In Focus. I'm Linord Moudou. It's time now for our twice-weekly report on African and global health issues. Today we're going to tell you about seniors and the challenges of HIV. 30 years into the HIV/AIDS epidemic, better treatment is enabling people living with HIV to grow older. The number of people aged 50 and older living with HIV/AIDS has been increasing in recent years due to highly active antiretroviral therapy, but new AIDS diagnosis among older adults is rising. The U.S. Centers for Disease Control and Prevention estimates that 1 out of every 6 new HIV cases in the United States is among adults over age 50. Medical experts say addressing HIV/AIDS among older adults presents several challenges. They say some older persons may be less knowledgeable about HIV/AIDS and therefore less likely to protect themselves. Older adults may delay getting tested for HIV, and many do not perceive themselves as at risk for HIV, therefore may not practice safe sex. For more on this subject, we are joined by Bethany Brown. She is a policy director with HelpAge USA, an advocacy group for adults in the developing world, advocating for adults in the developing world. Ms. Brown, welcome to In Focus.
Thank you for having us.
First of all, what do we know about the rate of new HIV infection among older adults in Africa?
It's rising. It's rising for a number of reasons. Older people throughout the region are living longer on antiretroviral therapies, which means that there's a longer period for infection. There's more time for them to learn about the disease, to help themselves, to help their peers, and to help the people that they care for.
Then what are some of the challenges that they are faced with? Because a lot of time when we hear about HIV and treatment and research, it's usually about, you know, the population younger and 25 and older. So what do we know? Well,
we know that UNAIDS in 2006 changed their policy to include all adults over the age of 15. Before that, their official policy regarding HIV and AIDS data was for people aged 15 to 49. There are a lot of people out there over the age of 49 everywhere, particularly in Africa. In sub-Saharan Africa alone, older people over the age of 50 make up over 14% of those living with HIV and AIDS.
And some of their challenges will be like access to treatment and things?
It's similar to some of the problems faced in the US. People don't think of themselves as being at risk. Healthcare workers are sometimes not trained to see older people as being at risk. They also face discrimination in access to health care. They think of AIDS clinics as being places for younger people to go. They're concerned about their own confidentiality if they have trouble hearing or if they have difficulty reading. They can't read their own test results sometimes, and those are barriers to just having the testing and counseling that they need in order to get healthcare treatment.
What do you think that needs to be done to maybe address this issue?
There needs to be a great change in policy information and awareness for older people. They need to have an understanding of the education and prevention techniques that are out there for them.
Now, there's another aspect of seniors and HIV, which is the fact that they are affected as caregiver in the context in Africa. Tell us about that, because that's an issue that your organization really focuses on.
We do. In East Africa and Southern Africa, over 50% of orphans and vulnerable children are cared for by older adults. Those older adults are each caring for an average of 3 children. That means that an older husband and wife are caring for an average of 6 children each in these situations. Over 50% of children orphaned by AIDS in Tanzania and Kenya are cared for by their grandparents alone. The amount of work that they do is just staggering, and it increases the likelihood of poverty for themselves and their households.
So how do you address this issue then?
This is something that can be addressed through better work at the international level through the WHO and UNAIDS, better collection of disaggregated data that shows what the age groups are that are getting HIV and AIDS, and better treatment methods and prevention techniques that are geared towards those age groups who may not see themselves as being at risk.
Okay, well, thank you so much for joining us today,
It's
Ms.
a pleasure.
Brown.
Thank you.
And that was Bethany Brown. She is the Policy Director with HelpAge USA. We thank her for joining us today.